Oh man. I haven't exercised in 5 years. I'm obese and I've got hypertension. I think I'm going to turn my life around though. I'm going to start exercising and lifting weights. Oh man, my arm is feeling some pain. Oh God, oh, God. Gotta call 563. 563?
Hello, 563. What is your emergency?
I think I'm having a heart attack or something.
Why are you calling us then?
Who else am I supposed to call?
Clotbusters!
Clotbusters!
Something strange in the neighborhood. Who you gonna call?
Clotbusters!
There's something weird and it don't look good. Who you gonna call?
Clotbusters! We are Clotbusters, a group of experts that are experts in clot busting, and we are available at a moment's notice.
We found David here through our 563 line. Seems he's suffering from a heart attack, which is caused by a clogged blood vessel.
We each have our own expertise. Mine is angioplasty, Jack's is cardiac bypass surgery, and Andrew's is clot busting drugs.
Seems we need to relocate our patient here.
Oh, he smells like cheeseburgers.
Watch the wall here, fellas.
Alright, let's put him down nice and
Stabilize
softly.
the spine.
Oh, it's bad.
My specialty is angioplasty. I'm going to thread a thin tube through David's blood vessel into the arm or groin up to the involved site in the artery. The tube has a tiny balloon at the end. When the tube is in place, I extend the balloon to push the plaque outward against the wall of the artery. This widens the artery and restores the blood flow.
Another thing we could do is cardiac bypass surgery. Now when I do this to David, I'm going to cut 8 to 10 inches in his sternum and then cut his breastbone open. Then I'm going to stop his heart electrically and hook him up to a heart-lung machine. Then I'm going to make an incision in his leg and take the great saphenous vein and attach it to the heart coronary artery. Then I'm going to attach it before the clogged part and then attach it again to another part that bypasses that clogged artery. That is going to give him some blood flow. He might have a little chest pain once he wakes up, but he'll be okay. Another thing that I might start doing is OPCAB, and this is a similar operation, but we just keep the heart moving and beating while we do the procedure.
Finally, we can give David some very powerful drugs. These drugs are able to work their magic through thrombolysis, the clinical method of breaking down blood clots. When participating in thrombolytic therapy, it is given through an IV line. The main drug I'm going to give David is TPA, which stands for Tissue Plasminogen Activator. This is a protein involved in the breakdown of blood clots. It is most commonly used drug for blood clots. TPA will make it harder to stop bleeding. So, if our friend David here were to unfortunately get severely cut, his blood would have a lot harder time clotting in the area of the cut. If you receive this drug, or a drug similar to this drug, within 12 hours of the first sign of a heart attack, you will have a better chance of survival, according to the American Heart Society. Even after I give David this drug, I may still have to perform an angioplasty in order to guarantee that the vessel stays open. Now, David, I'm going to give you a prescription dose of this here drug.
Well, it seems we've done all we can do for Mr. Fatty Boom Baladi. In order for our procedures to be as effective as possible, David will have to keep a healthy lifestyle and get rid of his unhealthy habits.
As for you viewers, you can avoid all these terrible things from happening to you by leading a healthy lifestyle. Try to avoid unhealthy foods, eat lots and lots of healthy foods, and finally exercise as often as you can.
Live by these rules and you won't have to call us Clotbusters, even though we know that you really want to because of our great hair and bodies, and we're just really neat. Unfortunately, not everyone survives an experience with the Clotbusters like poor David. Let's get out of here, boys. To the van! Miss Ross, you're the best!
Seems we need to relocate our patient here.
Oh, it smells like cheeseburgers. Well, it seems we've done all we can for Mr. Fatty Boombalatti. In order for our procedures to be as effective as possible, David will have to live a healthy lifestyle and try not to keep his unhealthy habits.
No!